Jay Swaminarayan, a very warm welcome to this evening's BAPS Wellness webinar, Active Steps to Beat Knee Pain. We are very excited to have you join this evening. I'm Rakesh, I'm a practicing GP in London and Surrey, and today we are joined by Dr Jay Patel, an orthopaedic doctor from the Imperial Healthcare Trust. We are both volunteers at the BAPS healthcare team. This webinar is one in a series of health and well-being topics spanning diabetes, heart health, to mindfulness and sleep. BAPS Wellness is an initiative focusing on 4 key pillars of nutrition, exercise, sleep management and stress management. This holistic approach is inspired by our gurus Bruja Brahmlok Sai Maharaj and Puja Mahant Sai Maharaj, whose teachings remind us to look after mind, body and soul. We are diving into a topic which affects and impacts so many people within our community, knee pain. The good news is that knee pain isn't something you have to put up with. There are real, simple and effective steps you can all take today to prevent it. We are going to talk about knee pain, but the focus is on action. That is practical steps you can take to keep your knee strong and moving well into the future. I'm delighted today to have Mr Theo Ross join us. Theo is a physiotherapist at Imperial Healthcare Trust, as well as a research fellow at Imperial College London. So without further ado, I'll introduce Theo.
Thank you very much for having me. I'm here to talk to you about knee pain and give you some practical guidance and tips on how you can help manage knee pain. So first off, I want to provide a bit of an explanation of what can cause knee pain. So there really are 2 sides to the story here. We look at the bottom right picture. I think people are quite familiar with the idea of sporting injuries. Okay? Someone who lands in a peculiar way or gets tackled in a peculiar way. And these tend to be quite high energy, high load injuries that might cause some damage to ligaments, tendons or muscles, in some bad cases bone. So this is what we call kind of a traumatic injury, and this doesn't have to be sporting related. This can also be the cause from a fall or for example falling off a bike, or some nasty cases, car crashes and things like that. People tend to make a good recovery on the whole, but there can be some lingering issues that carry on for a period of time, but we can talk about that later on. In the picture above, there's this idea of overuse injuries. This can typically come from workplace injuries, where it's a pattern or repeated movement that you do a lot over and over again over time. That can cause some pain, discomfort, and a classic case of this are people who are in labouring jobs, who work long hours on uneven terrain, often lifting heavy, awkward things as well. That can cause irritation to structures in the knee. These tend to linger on for quite a while, but tend to be kind of less severe cases. But on the other side, there's this idea of underuse. I think a lot of people don't consider this aspect. And if you can see in these pictures, it's this idea of lying down, sitting down for too long, you're taking the escalator instead of the stairs, you're driving instead of doing a short walk. It's this idea that all these things in modern life that make our life easy can cause our body to kind of weaken over time, our muscles, our bones and things like that. So then when you have to do a demanding task, whatever that may be, you get invited to go on a long walk with friends or something like that, it becomes quite a challenge for your body, and this can lead to injuries. So you become susceptible to injuries. I would just like to point out that all of these things in isolation, moderation, are not necessarily a bad thing. Like playing sports is good, working in hard situations is good, lying down is absolutely fine. But I think, like most things in life, I think too much of anything is usually a bad thing. So I'd like to talk about knee osteoarthritis. So this is the leading cause of knee pain globally. So there's a good chance that either yourself or someone sitting next to you or friends or family will have knee osteoarthritis. So this is a disease that affects the joints. So it can affect lots of different joints in your body, typically your knee, your hip, sometimes your wrist and fingers and your shoulder. And this is effectively the cartilage in your joints, the thing that helps them glide smoothly over each other, breaks down over time and can cause a loss of joint space and cause the bones to rub together in severe cases, which can lead to pain, stiffness, swelling, and ultimately a decline in your ability to function and do everyday tasks. So knee osteoarthritis is something that we have no cure for, and it slowly kind of gets worse over time. In some cases, it doesn't get worse; it kind of stays the same. But this kind of shows the importance of knowing what to do and how to protect your knees and things that you can do to maintain your function for the rest of your life. So just briefly, what causes knee osteoarthritis? Well, as you can see, there's lots going on and it's quite complicated. We've already spoken about a few of these things, such as trauma to the knee, so injuries relating to sport or accidents and things like that can increase your risk of knee osteoarthritis. If you look at age, unfortunately, as we get older, like most health conditions, our susceptibility to developing arthritis increases. Hereditary, so this is your genes, so what you inherit from your parents. So unfortunately, if you have parents or grandparents who developed osteoarthritis, there is a slightly higher chance that you might as well. There's one thing on this list that I'd like to draw attention to, and that's obesity. So the research tells us that obesity is one of the key risk factors for the development and progression of osteoarthritis. There's this obvious idea that you're carrying more weight. It's going to be a little bit more pressure on your knees. But there's also this understanding that when you are carrying excess fat in your body, you have this constant low level of inflammation. Now, inflammation in settings where you're injured is very helpful. It helps protect our body. But when it's happening all the time, our bodies don't really like that. And this is the case for your joints. So as I speak about some of these things here, you probably noticed that there are things that we unfortunately can't change. Okay? We're all going to get older. Your genes are what your genes are. But there are things that we can do, things that we can focus on. We can manage our weight effectively, and we can adopt healthy lifestyle habits, exercise, make our body strong and robust so that we can carry on doing the things that we like doing. And resist all the demanding kind of activities that life throws at us. So that brings me on to this idea of joint health. So I really want people to start to think about joint health the same way they think about other conditions, such as heart health, or the way you manage diabetes, for example, or anything else that you might have going on. You have the ability to make a difference to your own health and implement healthy lifestyle habits, be proactive. So exercise forms the cornerstone of treatment for osteoarthritis. Our joints love to move and to be used, and that's how they stay healthy and strong for the rest of your life. So I'd like to kind of make this point as well. I think it's really important that joint replacement surgery should be seen as the last option. So what I mean by this is sometimes, for example, I have patients that come to me and they say, I don't want to do these exercises. I'm not going to do it. I'm just going to have a joint replacement surgery. I'll be fine. I think this is completely the wrong attitude to have. An orthopedic surgeon won't just put a knee replacement or a new hip in your body there and then. Right? So you may be spending years and years and years and years, a long, long time, doing nothing, not doing anything about it, your pain slowly increases, your function worsens to the point where you can't do anything about it. You can't do anything for yourself. You're relying on others. So you should be doing everything in your power to try and keep your body and your joints healthy. So how do you do that? Well, we're going to discuss a few of the key things that I think are important for maintaining healthy knees and managing knee pain. So strength, the idea of being strong, why is that important for knee health? Well, everyday activities, whether it's walking, going up and down stairs, getting in and out of a car, carrying shopping, playing sports, whatever it is, it requires a lot of effort. And our muscles and our joints work together to bring about movement. And if your muscles are weak, they're not doing their part of the job. So your joints are taking more of the load, more of the stress. And over time, they don't really like that. That's fair enough. So this can lead to the pain, discomfort. In some cases, may lead to contribute to the development of things like osteoarthritis, the worsening of it. So muscle strength or strength in your body is so important for other key movements as well, or key things that help your movement, for example, balance. If you don't have the foundation of strength, you're going to find it very, very difficult to manage a complex task like balance. So if you don't balance, you may be increasing a risk of things like falls, which can lead to more serious consequences other than knee pain. So how do you maintain your strength? How do you improve it? Well, there's this saying, use it or lose it, and that is absolutely true, because muscle requires a lot of energy for your body to maintain. So if you're not using it, if you're not stimulating your muscles, your body's just going to get rid of it. They're going to get smaller and they're going to get weaker over time. It's going to get worse and worse. So that's where this idea of resistance exercise, we call it, or using weight and load to stimulate your muscles, is so, so important. I think this is one of the most underutilized forms of exercise in the general population. So I think that's due to a couple of reasons. One being that people perceive this idea of weight training to be something that someone does and go to the gym and because they want to look a certain way. And that's absolutely not true. This form of exercise has a purpose. It helps us maintain our function, okay, and can help maintain reduced pain levels. So you can start this in your house. You don't have to be in a gym. You start this in your living room, your kitchen, your bedroom, whatever. You can start this form of exercise and activity yourself in your own home. You don't have to go to a gym. Okay. You can have a very, very simple, easy way to start this. And if you've never done any form of exercise or activity before, using a simple task like a stand up and a sit down to a chair, seeing how many times you can do that in 30 seconds. Very, very basic way to start. The idea is that over time you slowly introduce this concept of a load or weight. Okay, you're challenging your muscles a little bit more, and that doesn't have to be a specific gym related weight. That can be a bag of rice, it can be bottles of water that you put in a bag, anything that is a little bit heavier that your body's not used to, that's going to make your muscles feel a little bit tired. That is the key. So if you can slowly increase that and get to a point where you're doing this twice a week for a full body, lower legs, trunk and arms and upper body, that would be an absolutely amazing place for most people to reach. I won't go into the details of what exercises you can do because there's so many of them out there. Different exercises target different muscle groups and things like this, but there'll be some useful resources that we can put in the chat or disseminate after this as well. For example, Versus Arthritis is a great charity website that has lots of useful information about how to get started with this type of exercise. But my key takeaway is don't be scared of it. It's for everybody, and it's something that everybody should be doing, and it's so, so important for knee health. So move, move, move. What do I mean by this? So our joints love movement. So when we move, they actually produce a fluid that helps the two bones glide really, really smoothly against each other. We know as well that movement exercise can actually reduce that thing we spoke about, inflammation in your joints. So it's a very, very powerful tool. It's not only joint health that this will benefit as well, physical activity. It's your cardiovascular health, so your heart, your lungs, and even your brain, basically everything in your body. So I often get the question from patients, what is the best form of movement, physical activity that I can be doing? And I say the best one you can do is one that makes you feel good, one that helps your pain, an activity that is accessible to you, something that you can do consistently, and something that you enjoy as well. So that can be anything, whether that's walking, cycling, yoga, tai chi, stair climbing, swimming. It doesn't matter. It's just got to fit those criteria. It's got to be something that you can do for forever, okay? And consistently. So I think there's a lot of trial and error with this. I think sometimes people get recommendations from friends or family saying, do this, this is the best activity you can do. This has really helped me. And that may be the case, but you try it and you think, this is not helping, it's making my situation worse. And that's absolutely fine. You try a different activity. And it might be a case for a while, you're trying different things until you find the thing that sticks for you. With this, aiming for the UK guidelines are a total of 150 minutes of moderate activity throughout your week. And that seems like a lot. Maybe break that down to that's 20 minutes a day. And that includes things like walking. So if you walk to the shop, it really isn't very much movement at all. So it's all about trying something and getting involved in any activity. So this point is so, so important. I think if you're going to take away one key message from this talk today, it's that consistency is key. So I want people to try and find an activity they enjoy and do it for the rest of their life. Sometimes what I get in a clinic when I'm seeing patients, so they go away and they come back, it's been 6 weeks of physiotherapy, and they say, this hasn't made a difference, I'm not going to do this. And again, I think the physiotherapy is we really try and introduce these concepts to people and get people on board with making healthy, proactive lifestyle changes. This is not something that you need to do for 6 weeks and you're good to go. Like I said, osteoarthritis is unfortunately something we don't have a cure for, and it will be with you for the rest of your life. So you need to be doing something about it for the rest of your life. And building healthy habits is really, really hard, and I appreciate it is probably the hardest part of this whole process. When we're asking you to do something, to exercise, try something new, and it's painful, okay, you're going to want to give up because it's easy to think that pain is a bad thing, but pain is very, very complex, and we know that the amount of pain that people feel doesn't necessarily mean it's causing damage to you. I think that's a really, really important point. So it's not a case of giving up at the first sign of pain. I think this point as well, that your body needs time to adapt. It takes time for your muscles and your bones to get stronger and develop over time. You won't be expected to maybe notice a difference in 1 or 2 weeks. It's going to take weeks, maybe even months in some cases. So it's all about habit formation. This idea of the 3 R's of habit formation, I think, are really, really useful. So a reminder, right? You need a cue to tell you do your exercises, your physical activity, whatever it is, whether that's sticking something on the fridge, having a reminder on your phone, having your friends and family kind of remind you, or whatever it is that just gives you that little reminder that you need to get it done. And then it comes to actually doing the thing. I think this is really challenging. I often find that if people join groups or group activity, that's a really, really good way of getting into it because you can encourage each other. Also, if you are joining a class or something like that and you have some time booked in, you're kind of accountable for that time. But if you don't want to do that, you want to do it in the comfort of your home, that's absolutely fine. Some people like to schedule a particular time in their day that they will be doing these their exercises. Some people like to do it randomly throughout the day. That's absolutely fine. You just got to work out what works for you. Lastly, this idea of reward. I think this is the key point to this habit formation. If you're not getting any benefit from it, you're not going to continue doing it. I think that comes back to the idea of that your body takes time to adapt. So you're not necessarily going to notice your function improving or your pain declining straight away. And I think that's where people fall at the first hurdle. So I always say, try and reward yourself in other ways in the first few weeks, months. That can be as simple as if I do all my exercises for that week, I can allow myself that treat on the weekend, whether that's food related or going out with friends and family or whatever it is, whatever works for you. So this is really, really important as well. It's never too late to start. And this, I think, is one of my key annoyances in clinical situation. I'm providing this information to a patient and they just flat out say, I'm not doing this, I'm too old to do it. And I think that is it's not an excuse at all. I think we need to start to move away from this idea that age is just is something that you accept and your body just declines over time. Yes, you're not going to be the same sprightly self that you were in your 20s, perhaps, but you can still do things and do things well. And I think this lady here, Roshni, actually signposts a lot of my patients to this lady. She's a great inspiration. So you can see she started weightlifting at the age of 68, having no prior exercise experience at all. And as you can see, she started this because she had knee arthritis. I think the story goes her son, useful to her, was a personal trainer, so persuaded her to get in the gym, start lifting some weights. And she initially was reluctant, found it painful, not beneficial, but she stuck with it. And as you can see, it's been a massive success story. Here you say the real victory is living pain-free. Now walk without fear, sit cross-legged and move with ease. She says, now I have so much energy, my joints don't hurt, my posture is better and I feel more confident. Even heavy chores no longer leave me tired. So you can really see the power of how exercise, how healthy habits, taking life into your own hands can have in managing these things. And it is never too late to start these things. So if that's something that's been blocking you, go and visit this Instagram page. If you don't have Instagram, if you have friends or family who do, go and have a look, get inspired, because she is a huge advocate for the use of exercise for managing chronic pain, in particular in older people. So lastly, I wanted to just sum up and give some quick tips for managing knee pain. So I appreciate there'll be people with different ability levels, different levels of pain, different goals in life at the moment. So I tried to kind of give a whole range here. So, I have knee pain and I have never exercised before. This is all about the habit formation, starting to try and build healthy habits, gradually increasing your daily activity. I always say do little and often. What this means is frequently throughout the day, you're doing small little bouts of exercises or movements. If you've never done anything like this in your life, it could be asking quite a lot of your body if you decide to do everything in one big go and spend an hour doing exercise. So try and break it down into manageable chunks and do it frequently but little throughout the day. Find an activity you enjoy. We've spoken about it. It's so important. Join a group, get family and friends involved, and setting yourself short-term goals. So this middle category here, I have knee pain and I am already an active person. So these are for people who are already maybe got a walking routine, maybe do a bit of running, something like that, or they're pretty active, always on their feet, but they still have knee pain. And I'd say with this group of people, this population, I think the biggest thing here is that strength training, this idea of resistance training, being strong is the key thing that's missing. And that makes such a difference to people's lives. So adding something like that in that we've spoken about can be really useful. Keep track of activities that flare your pain up. I think this is really important. So if you know the specific thing that makes your knee feel bad, it's okay to maybe avoid those things or do things that you can modify that particular activity or task. Consider a pre-activity warm-up or routine. If you have something that you enjoy doing, but it's becoming difficult because it's painful, sometimes doing a simple kind of warm-up routine, whatever that may be, there's hundreds of different ways you can move your body, warm it up, stretch, whatever. Sometimes there's a thing called a warm-up effect where your knee pain can start to subside if you just give it a bit of gentle movement, which then allows you to take part in the activity you enjoy. Rests are fine, but don't be inactive for long periods of time. This is so important. I think the biggest downfall for this group of people, there's maybe a flare of pain and you stop doing all your activities for months. All that hard work you've done doesn't go out the window, but it becomes very difficult to get back into it. So try and keep that routine. You go away on holiday or you busy weekends, that's absolutely fine, but try and get back into it. This last category, so I have knee pain and I'm a very active person. So this is for the people, probably a minority of people, but they do exist, where you're already doing all of the exercises. You're already doing strength training, you're already doing all the physical activity, but I'm still got knee pain. So it becomes tricky, but one find that modifying painful activities can be really useful. There are very few occasions where I tell people to not do a particular activity, but if you can modify it and change it in a slight way, that means that you get less pain, you can still do it. That's amazing. Spread out intense bouts of activity. So if you're doing lots of running, for example, try and give your body a little bit of rest in between. Address areas of weakness. So there's always going to be things that you can improve. So if you are playing a sport, if you're playing tennis, for example, it's a very, there's lots of different aspects involved. It's not just strength, it's balance, coordination, all these things. So you need to make sure that your body is capable of dealing with those demands that you're asking of it. And this last point, listen to your body. More is not always better. Okay? Trying to hammer your body all the time, all day long, to try and get the best out of it. Sometimes you just need to take a step back, ease off a little bit, and that could be the key to managing your pain a little bit more. So I believe we have put these links in the chat, or they are available, but these are the really useful resources. Arthritis UK, UK charity, they have such useful information on there. So I would encourage you to go and have a look. Read up on arthritis, how you can start with all these exercises and activities. So thank you very much for listening. I would just like to say as well that For people who took part in the gait analysis at the Wellness and Health Convention, we are currently in the process of analysing all of that data. But there's been some technical issues. As you can understand, with any novel approach to research, there are some kind of learning points. So we're trying to get that out as quickly as possible.
Wonderful. Thank you, Theo. That was a really informative talk, but actually quite inspirational, because actually it kind of fits in with what we've been doing at the Temple here, talking about nutrition, exercise as two of the big four pillars that we've been sort of promoting. And fundamentally, everyone who's watching this webinar today and those who watch it in the future on YouTube, there is something that you can do starting tomorrow, and it doesn't impact you if you feel that you've never exercised before. There are still simple steps you can take to improve knee pain or just to keep your knees in a really good condition. I think some of the key take-home points, is get involved. Just start, create healthy habits, and you don't need to spend hours a day doing it. It can start off with a few minutes. You mentioned sort of using a bag of rice and using that as a weight. And that case study you use of Roshni is a 70-year-old lady who sort of started doing weight training. I think that's phenomenal, and I think that's quite inspirational to all of us. And finally, I think it's important when you're creating healthy new habits that you do reward yourself. So if that's, a lovely meal after a week or something, doing exercises, that's absolutely fine. But just getting into the routine of things is so important. So very, very, thank you for that. So we're now going to answer some common questions and myths about knee pains, because there's quite a few of them going around. And I'll welcome Dr. Jay Patel to this segment as well. So I welcome everyone to post any questions you have for Theo or Jay in the chat, and I'll try to ask them. And I do request kindly that you keep your mics off and just pop a comment in the chat, and I will try and ask all the questions that you put in. So Theo, many people in our community sit cross-legged on the floor. Is this harmful for the knees?
So I'd say absolutely not. I think it's absolutely fine to be sitting cross-legged, especially if you've been doing it for a long time. Since you were a child, you probably have the mobility to be able to sit in that position. So short answer, no. What I would say though, like with any prolonged sitting posture or anything like that, it can be a little bit uncomfortable if you hold it for a long period of time. So if that is the case, especially if you do have things like arthritis and knee pain, having breaks where you stand up and move around can be really useful. Other things like sitting on a slightly raised pillow or having a pillow resting your knee that just takes a little bit of pressure off can be really useful as well.
Thank you. Jay Bay, if your knee clicks or cracks when moving, should you be worried?
Just fine, everyone. Generally, when it comes to clicks and cracks, you should be worried if it's sudden and associated with a fall or an injury. You should be worried if it causes locking when you can't move your knee past a certain point, or if you get any very, very large amount of pain associated with your clicking and cracking. However, if it's gradual, you don't get that much pain from it, and it's similar to the amount of pain that you get on a normal day-to-day basis as you walk, wouldn't worry about it at all. I wouldn't modify your activities. I wouldn't stop or rest or do less, because in the long run that's only going to make it worse. So yeah, clicking and cracking associated with no knee pain should be completely should generally actually just be quite ignored, and you should crack on.
Thank you. I've got one for you, Theo. So this is something I hear quite often, that when people start to exercise that causes pain, should they stop?
Yeah, so this is a really, really common point. And as I spoke about earlier, it's very, very normal to experience knee pain when you're starting to exercise. And as I said, pain is really, really complex, and it's just because you're feeling pain, discomfort in your knee, doesn't mean that it's causing damage. And this is a really, really important thing to understand. So no, you shouldn't stop when you see these first signs of pain. What I usually say to people is we use a scale where 10 is the worst possible pain you can be in, 0 is nothing at all. Anywhere up to 5 is a good place, or it's a manageable place to be. Okay? So if it creeps above 5 when you're exercising, it's probably not causing you any damage, but it might not be a nice place to be. So it's fine to stop there, maybe try again later on or the next day. So that would be my advice.
Yeah, I think it's really important that you try again and you don't get disheartened that it's hurting. And something you mentioned earlier is modifying what you do. So it might be sort of cycling causes you pain, but there are plenty of other activities that you could try, and you've just got to find the one that suits you. I've got one for you, Jay. So lots of people use supplements like collagen or other over-the-counter sort of herbal remedies. Do they help? And if they do or don't, is there anything that does actually help?
Super relevant question. Have a lot of people in clinics asking us this. They generally ask whether collagen is something that they should take, glucosamine. The general rule, glucosamine, not good evidence. There's lots of randomized control evidence that says that it doesn't really make a difference. Collagen, especially for our community, is often not vegetarian, is the main thing, and difficult to get vegan forms of collagen, but again, doesn't really have strong evidence behind taking it regularly. The two supplements that do really have strong evidence, one of them is a daily multivit, and the other is vitamin D. If you screened our community, it's probably the most common low vitamin that we'd have. The NICE recommend a daily supplementation pretty much for life for most of an adult South Asian population. And it's quite a cheap and easy test to do. Approach your GP, you're already in a high risk group, and say, I'd like a vitamin D test. You may be super low. There is no direct link between vitamin D and improving knee pain. However, vitamin D will help with your muscle function, your bone health, and it will reduce sort of pain sensitivity. And it's really important in all three of those pathways, and all of them, osteoarthritis is a picture, and it will contribute quite significantly to your overall daily activities if you're not on top of it. So it's something that's super important to get on top of. Go see your GP, get a blood test, take the right amount of vitamin D every single day, whether it's maintenance or replacement, and keep taking it. It's really important.
Yeah, thank you for that answer. And I think it's probably important to highlight that there aren't any quick fixes. It's fundamentally you're empowered to make a change in your lifestyle. And we spoke about exercise and movement, but it's going to take time for that to have a beneficial effect. And the evidence suggests that actually movement is the best medicine for knee pain and arthritis. I've got one for you, Theo. I've seen a few bits, sort of messages in the chat here about plantar fasciitis and footwear. But do shoes and footwear make a difference to knee pain?
Yeah, this is a really interesting one. Again, the evidence, so the research is quite mixed on this. And that kind of is reflected in the clinic as well when I see patients. Some people find that wearing a particular shoe, whether it's a kind of a running style trainer that has lots of cushion, they find it really, really beneficial. Some people don't find it beneficial at all. So my advice would be that these things are not going to cause you any harm. So it's something that can be tried and used. And that's the same for things like knee braces as well. But what I would say is that I don't like people relying solely on that as a way of managing their knee pain. What I say is, because they're quite passive interventions, so it allows you to engage in the exercises and activities. I think that is a great use for it. So yes, try different footwear. I would say though that now there are so many different types of shoes out there with different soles and insoles and all these things. So it's very, very personal. So if you are going to invest in a pair of shoes to help with your manage your pain, I would say go and do them in person and try them on first before you make that commitment. So yeah, give it a go. If it works for you, fantastic. If it doesn't, don't worry about it.
Thank you. I mean, we hear a lot about sort of people having knee replacements. So, Jay, when do knee problems move from needing physiotherapy to potentially needing a surgical intervention? And is there anything you can do sort of in between that?
Again, common question. If you have knee pain and you go to the clinic, generally patients' expectations are the doctor's going to try and give me a knee replacement. I think it's super important to consider that the general pathway is you go to your GP and you say you have knee pain. The GP refers you to the MSK service, who will assess your knee pain, give you a variety of exercises. They'll recommend lifestyle changes, weight loss, activity modification. And then if you do all of those things and you come back and you say, I still have knee pain, they'll get an X-ray and they'll refer you on to the orthopedic clinic, which is where you'll come and meet us. More often than not, the next best step is always going to be more activity modification. But if you really exhausted that option, steroid injections are a really good middle ground, especially if you're quite young. The steroid injections are quick, they're easy to do, they can be done in clinic, and they often give you, 12 months, 18 months, 24 months of really good function. And sometimes people have one, sometimes people have two, and it just gives them a bit more time with their native knees, with the knees that they were born with, to keep going on the activity, keep going on the weight loss before you get a massive, big hit of an operation. So steroid injections are the middle ground. And then, look, if you've tried everything and you've genuinely modified your lifestyle, you optimized your diet, you lost weight, you've tried some steroid injections, and your knees look awful on your x-rays, you're getting lots of pain and you're not really able to exercise anymore, it's a good point to start considering surgery.
Wonderful. I'm going to ask you for some motivation here, Theo. So what are the top 3 things people can start doing today to protect their knees long term?
Yeah. So my top 3 would be, I think, number 1, just increasing your general physical activity. And this immediately doesn't need to be going out and doing a long bike ride or anything like that. At a basic level, this can be increasing the amount of time you're on your feet, moving throughout the day, go and walk to the shop instead of driving, things like that. Okay, with the idea of then eventually you may progress into something that kind of that gets your heart rate going a little bit. Number 2, I would say try and add in some form of resistance or strength training into your daily routine. And maybe training is the wrong word here. I'm kind of used to saying that. But that's, like I said, can be really, really simple. That can be just a basic activity like practicing standing up and sitting down to a chair and doing repeats of that with a small weight that can be some bottles or a bag of rice, something like that, until your muscles get tired. And that's super easy to do. I'd say number 3 would probably be managing your weight a little bit. So as we spoke about, everyone's mentioned, Jay and Rakesh, the importance of managing your weight. And that can be a really kind of simple thing that you can do that you can notice quite a big difference kind of quite quickly as well. So those would be my top 3 tips, things to do.
Wonderful, thank you. So we're going to take some questions which are coming through into the chat. So the first one I'll sort of direct to you, Jay. So how can one resolve minor meniscal tears?
From that, I'm going to assume that these are degenerative tears and not tears associated with trauma or sports. Degenerative meniscus tears, for some context, the meniscus is a shock-absorbing layer of cartilage in between the knees, and you can get long-term small tears in areas that don't have a good blood supply, and they don't heal. And in your head, it seems like something that should be repaired. The problem is, and it's pretty much categoric, the evidence says that you should not repair these and you should not operate on these, and that you treat degenerative meniscal tears in the exact same way you would treat an arthritic knee. So activity modification by reducing the load on the knee, by reducing your weight. You improve your quadriceps function. So the muscles in the upper leg at the front, which help you straighten your leg, you strengthen those muscles, and they have there's a very good evidence base behind improving and strengthening those muscles and improving knee pain. Accepting that getting meniscus tears is the start of getting osteoarthritis, and treating it as such with everything that Theo's advised. And it is just a sign that your knee is biologically aging. So it is coming to terms with that. And surgery is to stress, not something that fixes this.
Wonderful. I'm going to ask a question to you, Theo, in relation to cycling. So can sort of cycling be a form of exercise, and is it beneficial for the knee, or would it make it worse?
So I think cycling is an amazing form of activity that I think is kind of helps in 2 ways, where it's really helps the cardiovascular system, so your heart and lungs, but it does also really get the muscles, as Jay was just explaining, the quadriceps, the big muscle at the front of your legs, working quite hard. It's really beneficial as well because it's quite a low impact activity. So sometimes what I mean by that is, for example, walking or going up downstairs or things like running, it's quite a lot of pressure on the knees, which is not a very bad thing, but for some people that can be quite uncomfortable. So an alternative being cycling can take some of that pressure away and can be quite comfortable for some people. But again, it may cause pain for others. So experiment, but cycling is a fantastic form of exercise.
And I just had a follow-up question from there, which I'll try and answer. So is it okay to use a static bike? So essentially, my opinion would be yes. So similar to what Theo said, the sort of movement within your legs is similar. So absolutely great to do. And another question, which is which exercise is better to do, cycling or treadmill? So fundamentally, I think it depends which one suits you. So not everyone will sort of have benefits from the same exercise. They may find one is more painful or uncomfortable. But really important point is you've got to enjoy it. So actually you do it long term. So I think kind of Theo said that earlier in his talk, that it's the persistent activity that's beneficial. So if you enjoy something, you're more likely to do it regularly. Another question for you, Jay. So I've got someone here who's got knee pain. They've had an X-ray and it's completely normal, and they're wondering what that knee pain could be. Any advice?
Yeah. So it all depends on your age, but it really this is the thing that's really important. Radiographically, so on an X-ray, a really, really nasty looking knee functionally could be amazing, and vice versa. On an X-ray, a super normal looking knee could have quite, terrible function for various reasons. Um, Osteoarthritis is a complex sort of condition, and it's all related to, lots of different factors. And what you end up with is knee pain when you're walking or not walking. Um, my best advice would be to, like, if it's injury related, do some more digging. If it's not injury related and it's totally random, start working through those things. You will do no harm by losing a bit of weight, increasing a bit of activity, you know, resistance activity, and improving your diet, and all of those things, like checking your vitamin D level. Like none of that can do you any harm whatsoever. So my strongest recommendation would be to just start working through that list, and you will. I'm almost confident that will get better.
I'm gonna there's some questions coming in terms of sort of herbal remedies, so things like turmeric and black pepper to reduce inflammation. Someone's mentioned sort of having knee pain and having eaten sort of raw potatoes, that's helped as well. I will try and answer that. I think fundamentally where the medical evidence lies is in activity and movement. So sort of strength building, making sure you're keeping your joint moving, that works, and we've got really good evidence that it works. I think using things like turmeric and black pepper perhaps isn't going to do any harm, but there's not significant evidence to suggest that's going to help with your knees. So to those who kind of sort of ask those questions, I think fundamentally activity is the most important thing. There's a question here which I'll direct to you, Jay, as well. Someone who's got osteoarthritis and rheumatoid arthritis, which is a type of inflammation in the joint, and then lots of pain. Is there anything they can do to manage the pain? And I'll ask that in terms of pain relief, because sometimes people are reluctant to take pain relief when they're in pain. What's your views on that?
Interesting question. There are two diseases which result in quite a similar symptom set. You could say that one gets better with activity, one is the other way around. But the treatment of rheumatoid is like totally different. The inflammation that's caused by rheumatoid is autoimmune in nature, and optimizing with your rheumatologist the autoimmune causes of your rheumatoid is one thing that's going to help, and doing everything with advice from the osteoarthritis point is primarily also going to help. Painkillers wise, I mean, all of it is okay. It is just what works for you. And speaking and working with your doctors about how much activity you're able to do, and working through that, and working through the different stages of those conditions, the different stages of treatment of those conditions. And don't get me wrong, it is quite tricky, and it is not that common either. So yeah, it would be just discussing with those clinicians as to sort of how you're progressing through those diseases and the treatments available to you. And they're getting quite deep. The depth of the rheumatoid arthritis treatment is getting like pretty strong, with biologics and different bits and bobs. So yeah, explore those options.
Last one for you, Theo. We've got someone here who's got a diagnosis of plantar fasciitis, so that sort of pain at the sole of the foot, and that's impacting their knees and causing sort of pain in the calf as well. Any recommendations?
Yeah, it's very common to have other things that are painful kind of around your knee. So anything around your foot and ankle or hip. it's the idea, so the kind of thought behind it is that if your knee is very painful, okay, you might change or start to change the way you walk. Okay, so then more pressure, for example, will go through your feet or your hips, so you end up having things like plantar fasciitis. Yeah, it's a bit of a tricky one to manage, but the same rules apply. It's exercise. It's more specific, targeted exercise for this kind of thing. Which involves kind of stretching exercises of your big toe, and even things like getting a ball and rolling out that big bit of muscle that sits in the arch of your foot can help with that. Things like insoles can help offload that pressure on your foot temporarily. So there's quite a few options. There's lots of information and useful resources about plantar fasciitis because it is quite a common thing to get. So there's lots of things that you can have a look at to try and help that. But yes, I would say don't let that kind of stop you managing your knee problems as well. I know a lot of patients, these other problems that happen can then exacerbate the other things that are going on. So do what you can to try and keep moving your knees, whether that's trying to find a way that you can take the pressure off your foot but still maintain the movement and strength in your upper legs is really, really important.
I have a tip for plantar fasciitis. Get like a Diet Coke can or something cylindrical, put it in the freezer, and then before activity or when you're getting pain, roll your foot on something super cold that's cylindrical. People recommend tennis balls and stuff like that, but I think the cold, in addition to its roundness, really helps pain, and I found patients benefit from it.
There's been plenty of questions. I'd like to thank everyone who's been involved because there's been some great questions. I'm going to try and answer a few of them. So there's been some questions about activity. Is swimming good for you? Is cycling good for you? Fundamentally, all activity is good for you. If you're not getting pain, you're enjoying it, and you can do it regularly, it's going to be beneficial, not just for your knee, but it's going to be beneficial for your other joints. It's going to be beneficial for your physical health, your cardiovascular health. It will help you shift weight. So in terms of the type of exercise, I think any activity is good, and that can include things like sports and things like that too. There's some questions in relation to particular exercises for knee pain or people who are sort of bridging physio to surgery. So I think it's really important, if anyone is experiencing pain, that you go and see a physiotherapist. So most GP practices now will be able to send you a link where you can self-refer and describe your symptoms, and you will see a specialist physio as the first point of contact who can start you off on the exercises. But I think one of the key take-home points today is with activity, movement, strength building, it takes time. You won't see a result perhaps in 1 week, 4 weeks, 6 weeks. But if you persist with it and do it long term, you will start to see the benefits. And we heard about a lovely case study earlier. So as we wrap up, I just want to say a huge thank you to Theo and Jay for sharing such practical and valuable advice today. I'd like to thank everyone. I think we had about 150 plus people here for being involved and taking an active step towards better knee health. If you found this session helpful, my biggest recommendation is start with some activity and start tomorrow. Just put in place 1 or 2 of the strategies that Theo and Jay have talked about. It will make a difference. Your feedback is vital to us, so there will be a feedback QR code being shared in the chat, so please do fill in that QR code. That helps us here to sort of direct and tailor these talks and what's best for you in the community. All of our wellness webinars are available on YouTube, as will this one, and I encourage you all to take the time and listen to them. Thank you again for joining us. Take care, keep moving, and we'll see you next time. Jay Summerline.